Good afternoon once again. Welcome to this webinar hosted by Minet Limited. We would like to discuss the COVID-19 vaccination and its impact in the workplace. My name is Doreen and I'll be your moderator for this session. Thank you so much for registering and for joining us this afternoon. I hope that you will find the discussion very insightful and it will answer most of the questions that we have. Yes, we know that COVID-19 has brought about a lot of controversies. I mean, towards the end of last year, we're all praying that a vaccine would be found, and then finally the vaccine was found, and we thought it would take a while for it to get to Uganda, but it came sooner than we thought. The vaccine is here, and we have mixed feelings about the vaccine. You know, there are many people who think they're not ready to have the vaccine. There are questions about the type of vaccine. There are questions on whether employees should have the vaccine. There are all those questions. So today we'll be joined by two experts who will be discussing with us. I'll briefly introduce them. We have Dr. Ombeva Malande, who is a vaccinologist and a senior consultant in pediatric infectious disease. He's a lecturer of many universities in East Africa and Africa at large, and he's a registered medical practitioner in Kenya, Uganda, Tanzania, and South Africa. He'll tell you more about himself just before he presents. And we're also joined by Mr. Douglas Opio, who is the Executive Director of Federation of Uganda Employers. It is commonly known as the Voice for Employers. You know, they offer advisory and guidance to Ugandan employers on pertinent issues across the country, pertinent issues like whether employees should be allowed the choice to take the vaccine or not take the vaccine. So I'll just remind you that you can post your questions in the Q&A chat. We will pick them up and we'll answer them at the end. We'll have the presenters present, and then after that in the Q&A, we'll pick all your questions and answer them. I'd like to appreciate those that shared their questions before. We were able to share them with the panelists and they have taken note of that in their presentations. Thank you so much once again. And in case your question is not answered, we'll make a follow-up and ensure that the panelists answer them, and we'll send you an email right back after that. Also to remind you that we'll be running some poll questions in the middle of the presentations. Please answer those and give us feedback. We'd like to serve you better. Thank you so much again for joining. We hope you'll engage in the discussion. You can send your reviews, you can send your messages in the question and answer, and also your questions once again. Thank you very much. And without any further ado, I'd like to invite our first speaker, Dr. Ombeva Malande. Doctor, over to you.
So thank you so much. Let me just share my screen. So thank you so much for this opportunity that has been accorded to me, courtesy of Minet. And I'm so happy that they could, Minet could organize this particular presentation and opportunity for us to continue to have conversations around vaccines. Just, you know, discuss together and figure out what is the best way for us to proceed in terms of controlling the current COVID surge that we find ourselves combated with. I need to say right away that I'm the director of the East Africa Center for Vaccines and Immunization. And this is an organization that deals with issues that relate to vaccines in terms of vaccine research, in terms of promoting the use of vaccines, advising governments, supporting health systems that relate to the use of vaccines and immunization in 11 countries in Eastern Africa. So you are talking about the 5 East African countries. Those are Uganda, Tanzania, Burundi, Rwanda, Kenya, and South Sudan, and then plus the 6 Horn of Africa countries, which includes, of course, Ethiopia, Sudan, Eritrea, Djibouti, Somalia, and yeah, so those particular countries. So basically what we do is that we support immunization systems. And this is one of the ways that we do this. We work with stakeholders just to make sure that the correct messaging is sent out there. I also teach at the university, as has been mentioned, and I'm also a pediatrician. My primary duty is a doctor seeing patients, and the issues of vaccines are important because they help make the work of the doctor easier. So today what I'm going to do is that I'll reflect a bit on COVID as a problem in Uganda, and then guided by the questions that majority of you sent to me, I've decided to come up with what is basically what people do not understand about COVID vaccine and what is the correct position. So I'll have misconceptions and what the correct position is. I'll have facts and what people get wrong as. So basically that's what I'll do. I'll share what is held and what is discussed out there on the corridors and what is the correct position or what really should be the correct position. Like I said, I do not have any commercial interest to declare. I don't work for Minet. I work for the government. I'm a civil servant. So it's important that that comes out quite ahead of time. So like I've mentioned, my intention is to debunk some of the myths that we have, information that people have on COVID, and then just be able to mention what do we need to do in our workplace to make us better protected, both against COVID and the importance for us to embrace the vaccine. If we looked at the current COVID-19 situation in Uganda, as you'll see that we've been having a rising number of cases for COVID in Uganda, and generally, at the moment, Uganda has registered about 47,000 cases now of COVID-19. And you could see from that graph that I've shown that Uganda is one of those countries that have done very well. If you looked at from really March, when we had our very, very first case, and up to towards the end of last year, the numbers were really, really few of cases that Uganda had seen in total. In fact, up to around October, as you can see from this graph, up to around October, Uganda hadn't even reached 10,000 cases. It's only towards the end of October and the beginning of November when the numbers of cases began to rise in Uganda. So that is when we had a sharp rise, as from November into January. And then from there, we have seemed to kind of plateau at that high number of cases. In fact, if you looked at again another kind of representation of the number of cases that we see, and you will see that in and around the period of November and December is when we had very sharp shooting of the number of cases that we've seen in the country. And they've pretty much appeared to reduce a bit into February and as we go into March. And this is a number of deaths. Again, you can see only until towards the end of October is when we began to cross the 100 mark of cases seen. And then between end of October up to around early December and into early January and into mid-Jan is when we had a very sharp rise. So the numbers of deaths really tended to coincide with the number of cases that we had seen. So as the cases rose, the number of deaths also tended to rise, as you can see in our cases in Uganda. If we look at in terms of the people who come with the cases of COVID, what have we seen as the biggest number of problems that they come with? So majority of our cases are coming with cough and fever. So pretty much that. And you can see that maybe only about 4 out of 10 of all cases that we see have fever. I know we use a lot of temperature guns at gates and what, but this has been called into question because we see that we have maybe 4 only out of 10 of cases that come with fever. But it's still important to have those guns, which are the thermal guns, because if you can pick these 4, it is so important. The 4 out of every 10 is so important, noting that in any case, only about 10% of cases of COVID will be symptomatic. What we don't want is to miss out this. So that is, and if you can be able to identify 4 out of 10 of all cases of COVID, it's very useful because between fever and cough and difficulty in breathing, there you have majority of cases. In fact, if you add on a bit of headache and sore throat and chills, then you will have pretty much picked majority of the cases that come with symptoms. This is a bit different than when we look at healthcare workers. The studies we've done in healthcare workers, we've seen that about 20 to 25% of healthcare workers come with symptoms, which is a bit different from what we see in the general population. Now, so that is what we've seen with COVID. And I need to mention something about COVID in children. In children, the situation is a bit different. We tend to see a bit more fever and fever than cough. So the children who would come with fever are around 5 to 6 out of every 10 children. If you compare that to what we see in adults. And again, remember, what we see in children is that most of them come with other conditions. So maybe the child had a pneumonia, a chest infection, and so this just adds on to it. That's how we've seen. So you need to remember that, like I've said, the bigger number of our cases have come towards the end of January and to this period of March. So that is when we've had the wave that you've been hearing about. It's because of those high rise that you can see there, those numbers that I've shown here. The consolidation and the kind of grouping of all cases here between December to around Jan, Feb. So that is what we mean by a wave, when you have a sharp rise in the number of cases that you see. Now, in terms of the vaccine, I need to mention that there are several stages through which making a vaccine passes. So if someone wants to make a vaccine for COVID, for example, they'll first have to decide that we need, they'll have to go and look for registration. And we do have bodies that do the registration for these vaccines. So they go, they request permission. They say that we have to, something we are making, a chemical, we want to test it for the vaccine. Then they're given approval. The National Science of Technology, like for Uganda, is the one that approves this kind of studies. Of course, there are many other approval bodies in different countries. And then when they ask for the permission, they'll be told, okay, you can go ahead and test what you have, the molecule that you have. And then they go into animals, and then they check on the animals. They inject them with this vaccine and then observe the animals. And they're observing for two things. One, they are seeing, does this kill the animals or not? Is it safe? And if they're satisfied with safety, the second thing they want to see, when we put it inside the animals, when we injected them, was it able to stimulate them to produce some kind of immunity? Those are the two questions they have to answer. And if they are satisfied that it has shown, they come with the results again to the scientific committee, and then the Science and Technology Committee tells them, okay, fine, we are happy with the safety that we've seen in the animals, we are happy with the stimulation we have seen in the immunity of the animals, so let's now proceed to humans. So about 89 vaccines are currently going on in humans, but around 77 are going through animal phases. So you can see there are so many vaccines which are currently being tested, and about 23 are reaching the very, very final stages of completion. So that means that there is a lot of research that is going on these vaccines. It's not that they were just hurried or somebody had it somewhere and decided that I want to use this to harm people. You know, like some of the stories you keep hearing, oh, it has microchip, it has what? No, these vaccines have to go through all these stages. In fact, once they finish the animals and come to humans, the vaccine is first checked. In a few people, let's say about 10 or 15 people, they're injected with the vaccine, and then they are checked for whether it is safe and whether it will stimulate their bodies to make a response. And we have currently about 52 vaccines which are going through that kind of a process. And then the second phase, what we call phase 2, is where you now say, wow, I'm happy with what I saw in the few number of people, maybe 10 or 15. Now, can we get a bit more people? And again, you just want to see, will it work? Will it produce the same results? And the other thing you also want to see is that, how does it behave in children? How does it behave in adults? How does it behave in women, in men? So you are able to now test it at this stage. It's called phase 2 trial. And then after that, if you are quite satisfied with what you've seen, you are happy with the phase 1 and phase 2. And in fact, there are some companies now, because of the danger of COVID and the need of a vaccine so fast, have combined the two phases. They have combined the phase 1, where you do it in a small number of people, and the phase 2. And they just lumped them together, and they were able to do that particular study. The first 3, you do a bigger study. You get many people, maybe 30,000, 40,000, even 50,000, and you test the vaccine in them. And again, you just want to see, will it work? And if it works, does it stimulate their immune system? Once you are happy with that, then now you can go and seek approval for the vaccine, because you've shown that your vaccine is able to work in humans, it's able to prevent the disease that they want, and it is able to stimulate their immune system. So those countries that have received Those vaccines that have received that kind of approval are about 5. And then the final stage is where you now take it for full approval and licensing. Because you're happy with what you've seen, you go and present your findings, and the Science Technology Committee will look through your findings. And then they will tell you whether they are happy or whether they are not happy with what you've done, and whether there are any things you need to change. Sometimes you can even be told to go and find more information. Now, for people making the COVID vaccine, they were given 3 strict guidelines. And this is important because you keep hearing people coming up with all sorts of stories, all sorts of conspiracies. The vaccine has this, the vaccine has that, it doesn't have this. But the most important thing is that they were given, the companies which want to make a vaccine were given 3 conditions. And it doesn't matter who wants, whoever you want to make, you must satisfy those 3 conditions. The first condition they were told is that the people who have received the vaccine, at least a half, or is it 50%, should show that they have at least 50% effectiveness. The vaccine should be able to protect at least 50% of cases that they get exposed. The second requirement they were given is that they were told to follow the volunteers of who get the vaccine. Because you know, when you're doing a vaccine study, the people who participate in it are volunteers. You are not like hiring them to pay them a salary or something like that, no. So they are like volunteers. And these volunteers will receive the first dose and then they will receive the second dose. So the requirement is this: after they have received their second dose, they must by minimum be followed up for at least 4 weeks. Now, the other question was, in terms of those who did not get the vaccine, because remember I told you, when you reach the 3rd phase of this study, some people will get the vaccine, others will not get the vaccine, they will get something else. Something, it looks like a vaccine, it's called a placebo. It can be like, let's say, this safe water for injection that doctors use in hospital is what can be injected in the people. They are not given the vaccine because you want to compare. You want to have some people who got the vaccine, you want to have some people who did not get the vaccine, and then you want to compare the two. So the ones who did not get the vaccine receive something we call a placebo, and you follow them up. And the FDA said, in these people who don't get the vaccine, some should get the disease. How many? 5. You should tell us that in that area where we gave the vaccine, 5 people did not get the disease. So these ones were done to make sure that the vaccine is above board. It is done to make sure that the vaccine is above board. And these vaccines all went through that kind of process. All of them went through that kind of process. Now, there are at least 4 types, let's say 5 of vaccines. The first one, they are using what we call RNA, messenger RNA, where they just use a message. There's a particular message the vaccine does. It gives a message to the cells and then they share it around and is able to protect the body the next time there is a disease. Another type is like the one we are using now, the AstraZeneca. And what happens is that they get another virus which is weak, and then, especially like from monkeys, the adenovirus, and then they weaken it completely, and then it is able to carry the vaccine into the body. So that's another thing one can do using the AstraZeneca vaccine that we are using now. And then there are other vaccines that are coming up and we do not have any that is licensed now, and that is the DNA vaccine. And then you could use viral proteins as well to be able to deliver the message onto the body about the vaccine. So these are the 4 main. There is one last one where they use an inactivated pathogen and they bring it into the body and they're able to stimulate production of immunity cells. So those are largely the ways in which the vaccine is made. Now, these are the types of vaccines. You can see I've listed them there, but I've listed only 4. I've listed AstraZeneca, I've listed Pfizer, I've listed Moderna, and I've listed Johnson & Johnson. Now, these ones that I've listed above here are companies. These companies make these vaccines. I did not include 2 other groups which have now come on board, but as we continue to receive more information, they should be able to add. Like Sputnik is a vaccine from Russia. And then we have another one called Bharat, which is from India. The commonest side effects, because very many of you are asking this question in the mail that I received. What are the common side effects of this vaccine? And you can see them there. Injection, pain, at the place where they injected, headache, tiredness, muscle ache, fever, chills, joint ache, nausea. Those are generally, in general, the commonest side effects that we see. Now, in terms of effectiveness, as you can see there, now there's one thing I need to mention about these vaccines. These particular vaccines do not change anybody's DNA. So, because you'll find people will tell you, no, this vaccine is going to alter your body, it's going to alter your DNA, people will be able to track you, they'll be able to listen to your calls. No, these vaccines do not do that, and they are not associated with those kind of things. They are safe. They are safe. And this list here shows us some of the vaccines that are complete and others which are being worked on. You can see there are so many vaccines which people are working on because there is such a concerted effort to be able to deal with the issue of COVID-19. And the list is long. You have Pfizer there, you have Moderna, you have Gamaleya. This Gamaleya one is done from Russia. Oxford, they are all there. And the Oxford one is the one we use in Uganda. Oxford is a UK company to work together with another company that has been known to produce drugs previously. It's called AstraZeneca. And you can see their vaccine is approved in Brazil, emergency use in the US and UK and other EU countries, and even here in Africa. Now, I've given you a bit of an introduction of vaccines, and I've also given you a bit of an introduction on Uganda's situation. So I'll quickly talk about the myths, which are really problematic because people make mistakes. And sometimes they assume things which are not correct. For example, there's this myth that says that COVID-19 vaccines manufacture was predetermined and accelerated, thus skipping various stages of visual, skipping several stages of usual prolonged vaccine manufacture process. The truth of the matter is that, like I've taken you through those stages, phase 1, phase 2, phase 3, phase 4, these vaccines have gone through those phases. They had to satisfy each one of those categorizations. But in any case, this technology that is being used by mRNA technology, it's been available with us for more than 10 years, actually 12 years. So it's not a harmful vaccine on those grounds. Studies have shown us that vaccines are important and they're only second to clean water. In terms of interventions that can help people and help children or help remove diseases, vaccines are so important. There are people who say vaccines will cause infertility. That's not true. The coronavirus cannot give you infertility. Previously, there were a lot of rumors about other vaccines. People complained about tetanus, and all those other vaccines, but there is no evidence to suggest now that anybody can get infertility because of this vaccine. Another one is that, another myth, there are people who say that the COVID vaccine affects and can change a person's DNA. As I've said, there is no way that the mRNA that is contained in that vaccine by Pfizer and in the vaccine by Moderna, because they're the two companies that makes the messenger RNA vaccine, it does not enter into the DNA of the body. And it doesn't enter into the DNA of the cells of the body. So anywhere, it will not have its entry to cause you problems, to change your DNA, to alter it. No, that's not the goal. Of course, the messenger RNA of COVID-19 does enter the cells. but it's not for the reason of causing harm to the DNA. Now, the other issue has got to do with the vaccination. There are people who are so worried about the vaccine and its safety. I want to use this opportunity to say to you that all the components that have gone into making that vaccine are safe. They've been tested. They've gone through the procedure. They've gone through the entire process that is required. It may have been done so fast, but it's because, you know, we've had a lot of technology and research, and so it is very easy for people to move through and identify. Now, you need to know that the first two FDA authorized vaccines contain mRNA, and I've mentioned those to you, Pfizer and Moderna. But they also have salts, and they also have a small amount of sugar. The reason why this was done, the vaccines were not developed using fetal tissue, and they do not contain any material such as implants and microchips or even tracking devices. People should not be afraid, if I get this vaccine now, people will track me. No. It is of help, of benefit to all of us to take up the vaccine. I know another myth. Someone says, if I've already got COVID, I don't need a vaccine. That is not true. Even people who suffered COVID will get the vaccine. And it is very protective, especially in those who already got it. You've also had it said that getting the COVID vaccine, getting the COVID-19 vaccine means I stop wearing my mask and taking coronavirus precautions. No. If you are vaccinated, still wear your mask. If you are vaccinated, still take care of your responsibilities. The reason is because a study recently in the UK showed that people who have received the COVID vaccine are 7 times more protected than people who have received the vaccine but did not have COVID. So you have two groups, COVID and they got the vaccine. You have no COVID, but they got the vaccine. In fact, the ones who got COVID and got the vaccine are ending up with stronger immunity. So it's important that we encourage all those who got COVID to be able to get the vaccine so long as they're in the category that is eligible. Now, there have been also people who lie to others that if you get the COVID vaccine, it will give you COVID-19. That's not true. The vaccine is a killed vaccine. It cannot reach your body and it begins to grow again. No. There are some vaccines which are live, like measles vaccine, like rubella vaccines. So those particular vaccines, we call them live vaccines because what we do, we just take the virus or the bacteria that would cause the disease and weaken it completely to the point where it cannot cause disease. But if the body sees it, it is able to produce protection. So the vaccine for COVID-19 cannot and will not give you COVID. The mRNA vaccines instruct your cells to produce a protein that is part of the SARS-CoV-2 coronavirus, which helps your body to recognize and to fight the virus. And the COVID-19 vaccine does not contain SARS-CoV-2 virus. That is a message that we all need to know. So don't worry when you get the vaccine that you are going to end up with the virus. No, it is not live. It is not like measles. It is not like rubella. It is not like chickenpox vaccine. No, it's not a live vaccine. You can look at this picture that I've put there that shows you the vaccine and the kind of storage capacity. And you can see that the Oxford AstraZeneca vaccine and the Gamaleya Sputnik vaccine are all stored at regular temperatures. But these other two, Moderna and BioNTech, they are stored at very low temperatures. This one is -20 and the other one is -70. So those temperatures are really, really low, what we call subnormal. That's why in Africa, we are tending to use AstraZeneca a bit more because it's easier for us to deal with our fridge requirements. Now, I've had people say the side effects of COVID-19 are dangerous, but they don't give you the exact danger they worry. They just say that vaccine is dangerous. I just need to tell you that this vaccine is worth it. Okay, you will take it and feel a bit of tiredness, a bit of malaise, tiredness, and you feel that sometimes muscles can pain, sometimes joints can pain. All of those are possible signs. And especially if people are, especially to the eligible populations, because not everybody is getting the COVID vaccine at this moment. Now, someone said, and there were concerns that maybe if someone has had the disease, is suffering from COVID at that time, and gets the vaccine, they can get more side effects. They can get more headache, more aches, because it can harm you when you already have COVID. The experience we have seen from people who have suffered COVID previously, or have the COVID at that time, is that they can still get the vaccine, and most of them are not getting a lot of side effects as one would fear. Now, there's another myth. Now that we have a vaccine for COVID-19, we can make choices. We can make vaccines for common cold, HIV, and other diseases. I think that is not directly true. The reason being that the technologies that are used to make different vaccines are different. We can hope and pray that the knowledge that the scientists have gained from COVID can help the efforts to get vaccines for HIV and for other diseases, but we do not yet have a breakthrough yet. Now, there's another myth that says that people with underlying conditions shouldn't get vaccinated. No, they should. In fact, those are the people for whom the vaccine has been found. So they should be able to get their vaccines. If you are having any underlying conditions, you'll also be able to get the vaccine. So all conditions, diabetes, hypertension, asthma, all of those should be able to get vaccinated. They are the ones for which the vaccine actually targets. So that is about people with immune suppression also. So what do we mean by immune suppression? People whose immunity has been lowered. Look at people who have HIV, for example. Those are people whose immunity has been lowered. People who are treated for cancer, those are people whose immunity has been lowered. Those particular people, they need to get the vaccine as well. Now, the other question that people have asked a lot has to do with pregnancy and breastfeeding. And this question was there in the questions that you sent me. Should one be vaccinated or not? The current guidance is that yes, they should be. If you've suffered COVID, finish only 21 days, and then you can be able to go back to be given the vaccine. So let's say that somebody had COVID today, they got a test, and the test showed that they were positive of COVID. They should finish 21 days, or they should do their test and see if they are negative. If they test today and see they are negative, even if they have not reached 21 days, they can go and get the vaccine. Breastfeeding mothers should get the vaccine. Pregnant mothers should get the vaccine. It is safe in all those categories and groups. And recently, you've heard people saying that COVID vaccines are not safe because they lead to clots. And if you've suffered high blood pressure or clots previously, you should not get the vaccine. Now, this study recently was done to try and figure out just how much risk are you when you use the vaccine in terms of getting clots. And if you look at this diagram, you'll see that majority of cases of clots have occurred in COVID patients themselves. The people who have COVID, they're at a higher risk of getting clots on their own if you compare it with the people who got the vaccine. Even in the general population, smokers, people who use contraceptive methods, they're at a higher risk of getting complications or COVID itself. You can see from this diagram, 16.5% times that you will get a clot because of COVID. If you compared that with a person who got the vaccine, only 4 in 1 million. So 0.0004% if you compare it with 16.5. So the clot is not a major issue and we shouldn't worry about that. There are people who also say that vaccines cause autism. Autism is a disease of children where the child gets problems with language, with speaking, and most of it in many children, it tends to come at around the year of half a year or 1 year, and maybe up to around 3 years, then it becomes very pronounced. That is autism. And the children who are autistic tend to be very violent because they have problems with social interaction. They also tend to be stereotypes. Stereotype means they can stick on just doing one thing all through. Those are autistic children. And there were always people who said that the MMR vaccine, the vaccine for measles, would cause autism. But studies have since proved that that was not true. And the MMR vaccine is safe. There are people who say vaccines contain unsafe toxins, like what we call aflatoxins. Others are like formaldehyde, use of aluminium in vaccines, and this has caused quite a bit of a problem. But it is true. Some of these things are used in the vaccines, but as adjuncts. What I mean is that they are there to just protect and support. Aluminium and mercury, they've been included in vaccines for very many years, but they are not unsafe. They stabilize the vaccine. They make the vaccine stable. So we shouldn't be worried about aluminium and we shouldn't be worried about mercury. Finally, as I finish, I need to mention that countries in Africa have received the vaccine that is called AstraZeneca. This vaccine, we have received it from a facility called COVAX. And COVAX means the vaccine pillar for the access to COVID-19 tools accelerator for global and equitable access for COVID vaccines. So COVAX has been brought together by WHO, the Gavi Alliance, and a body called CEPI. And so they provide vaccines to African countries, but they have asked countries to prioritize how they want their vaccine. So they initially gave 20%, and they want healthcare workers to get first, then the older adults, then those with serious health conditions. And the thing we need to know about this particular COVAX facility is that countries are given the vaccine for free, and so the countries are not allowed to sell those vaccines. And then after you do those groups, then you can come to other groups like refugees, asylum seekers, and workers in these areas where they are at a high risk. Now, the African Union has worked together with that COVAX arrangement to also provide more vaccines for Africans. The African Union is trying to buy vaccines for African countries so that the African countries can be able to catch up with the immunization programs. Like if a country doesn't have money, a country is given some money through the African Export-Import Bank, and it's told, use this money to get the vaccines, and then you can repay us slowly. Now, the rollout of COVID vaccine has been phased in different phases, because I saw in your question, somebody asked, why don't we have the vaccines all given to everybody? Why are they delaying some people and going for others? It has to do with the number of vaccines that we received from COVAX. So there were not so many, yet there was a big need and target. So the plan, therefore, is to prioritize the important groups first. So beginning with the health workers, because where they work is really tricky. And after that, you have a lot of people in the second group that is above 50 years of age, or people who have underlying conditions. So those will fall into phase 2. So phase 1 mainly looks at health workers, and phase 2 looks at these other categories of people. And then after that, we'll have phase 3, which will look at congregate settings. So you're talking about like settlement camps, refugee camps, and things like those. So this is the first rollout of the vaccine. Because someone asked me, why don't we just give it to all? It's because we don't have enough doses. So we have to go stepwise to make sure that everybody gets the vaccine. At the moment now, people with underlying conditions and people above 50 can get their vaccines. And then later on, there are people who are close to them will be able to get their vaccine. Thank you so much.
Thank you so much, Doctor. Thank you so much. I can see that he has demystified a number of myths that people had, especially about the types of vaccines out there, the side effects. I mean, Doctor has said all vaccines have side effects. You know, some of them are short term. You know, you'll get a fever, you'll get, you know, a funny feeling. So he said all vaccines, you know, all have side effects. So that should worry you. And I think he's pointed to the fact that things like blood clots, you know, we're susceptible to certain things, to such things like blood clots with other complications, you know, other than the vaccine. But overall, he has said the benefits far much outweigh, you know, just those short-term, you know, short-term things. Yeah, I hope there are not any people who got the placebo and are saying they have side effects. You know, that is one of the things that we didn't know. But thanks so much, Doctor. I see there are a number of questions that are coming in. We've taken note of your questions and we'll definitely answer them. And right now, would like to invite Mr. Opio Douglas, who is going to talk to the employers and what the expectations are on the employers. Douglas, the floor is yours.
Thank you so much, Doreen. Such a pleasure to join you this afternoon. I'll speak rather quickly. First of all is to thank you very much. That's how I look like. My background now is like I'm in a forest, but that's me. Thank you so much. Now I'll speak about the impact of COVID-19. And this is the outline of my presentation. I'll tell you a bit about FUE and then COVID-19 from unemployment angle. Doctor already did a great job trying to show us the situation from a health perspective. I'll give you a bit of suggestions of what you could do, especially around this time, the role of employers regarding COVID vaccine, and then of course, any legal implications associated with it. And second last is what you need to do as an employer. We have also prepared some tools for you, which are linked to issues of COVID-19. First of all, we are an employers organization. The voice of employer, like employers like Doreen said earlier on, we have been around for over 60 years now. We have members from all sectors of the economy. We represent employers locally, but also at the international level. Now, our work is divided into three: lobbying and advocacy, mainly for a good business environment so that businesses can grow, the levels of productivity can rise higher. Secondly, we look a lot on employment relations and legal issues, mainly from the angle of compliance with the law, but also best practices. We try as much as possible to support employers to use good practices. Thirdly, we provide extensive business support services. They could be in the area of recruitment, it could be in the area of responsible business, promotion of women in leadership, for instance, making our workplaces more inclusive for persons with disability, elimination of child labor, addressing also issues of forced labor as well. So that's what we do. Now, in terms of COVID-19, I'm sure all of us already know it by now. But what I need to reemphasize is that nearly all the countries of the world, people have been infected in over 185 countries. The ILO estimates that about 195 million jobs will be at risk. And this estimate was around June. So most likely this estimate might be low now because COVID-19 has been a lot more prolonged than we had actually expected. We expected by now things would have gone back to normal. So indeed, like the doctor spoke, the vaccine represents the most credible opportunity for us for work to resume and for people to begin to operate a lot more normally now. Globally as well, 4 out of employees have been affected by COVID-19. So that's putting it in percentage. It's 80% of employees have been affected by COVID-19. And by this, I mean negatively, not the positive dimension. So that speaks to how serious an issue is COVID-19 to the world of work. Lastly, a survey done by EPRSC and UNDP showed that in Uganda, from the negative point, 9 out of 10 businesses have been affected. They felt the preventive measures that the government was trying to put in place, of course, they were very useful, but they put a lot of constraint on businesses. Right now, the government has, of course, progressively been easing the lockdown measures. A lot more businesses are able to operate, but nevertheless, we still have a lot of restrictions because we have to observe the SOPs. The operation costs are still a lot higher, not like in normal times. What are some of the changes that COVID-19 is forcing on businesses, forcing on us as employers? I put them in 3 different points. First is that COVID-19 is forcing us to recalibrate, essentially to rethink the way we do business. We cannot continue with business as usual. We cannot continue with our budgets as if nothing is happening. Specific measures geared towards helping us to address COVID-19 issues need to be put in place. Secondly, the issue of resilience, the ability to be able to cope. Resilience from an organizational point, but also resilience from the point of view of individuals. The ability for us to cope with these difficult times. Some of us, our salaries have been reduced. Sectors like tourism and hospitality significantly affected. Some people sent on forced leave. It calls for a different way to approach things, issues of mental health as well, so that we are able to be a lot more resilient. And even from a company point, resilient because the inflow, the cash flow is no longer the same. So we have to use our resources a lot more efficiently. Secondly, is the question of refocusing. Refocusing to take the advantage of the opportunities which are brought to us by COVID-19. Not everything is bad. People who are manufacturing sanitizers, for instance, have an opportunity to do business a lot better during this time. At the beginning of the pandemic, only one company was producing sanitizers. Now, UNBS has certified close to 50 companies. We also need to look at reorganizing, might be restructuring our organizations to be able to deal with that. Lastly is the question of redirecting. Redirecting our efforts to the right cause, but also trying to ensure that employees are actually engaged. Difficult times sometimes cause us to be disengaged. The expectation levels at the workplace remains high because we actually need a lot more money, but you're working at half pay. That needs a different kind of mindset and a different way of work for us to be able to move during this period. Now, what are some of the suggestions for us to mitigate or minimize the impact of COVID-19? The first thing we ran several surveys, but these 7 themes were quite common in the surveys that we did during COVID-19. We are running even another one at the moment. The first one is to have a clear strategy how the business will continue, both in the short term, but also in the medium and long term. Secondly, reviewing contracts, not just employment contracts, but also contract of people who offer services to us, so that we are in a position to manage the current challenges. Thirdly, redefining roles where necessary, because some employees might have been rendered a lot more redundant because the work they were doing maybe is not as required much at the moment. So maybe you need to redefine roles. And I've spoken a bit about the issue of mental health, because we are under immense challenges. The social construction in our country is that when you work, you support a lot more people with you, and supporting a lot more people comes with a lot of burden. But now also your friends, your relatives have lost their jobs, and a lot more people are giving you phone calls to give them money. That can be stressful if you don't know how to manage it. And then, of course, our customers remain the kings even during this time. So re-engaging with them and trying to create new value for them as well. And then, of course, issues of business continuity. Lastly, the ability for people to work independently, empowering your employees so that they're able to deliver for you to get the right results. Now, what are the roles of the employer when it comes to vaccination? First of all, you need to have a policy in place, a workplace policy, so that you're able to manage specific things. For instance, how much time should an employee be given to go for vaccination? If they add vaccination and they add some mild side effect, how long will you allow them to be off work? Some of these things are not defined within our law, the Employment Act, but you can do it at the level of the workplace because COVID-19 was not anticipated within the employment law. But once you have your policy, then you know how to address it in a manner that is fair to all, not an employee feeling for this one, they gave them 2 days of leave. For me, they have given me only 1 day. There must be a clear criteria of what needs to be done. The employees, the doctor said its vaccination is in a phased manner. So maybe already all those you have to do an analysis. How many employees will need to be vaccinated within the workplace? How can we stagger it so that work is not affected? We continue doing business while vaccination is going on, not closing that today we are doing only vaccination because customers are looking at us. Secondly, regular communication. Employees are relying on us to be able to get appropriate information, and working with the Ministry of Health, there is a lot of information available for use by employers on a continuous basis. The doctor, I thank you very much, because you spoke a lot about the myth. Those are going on in the heads and minds of so many employees, but the employer has the responsibility to provide the right communication to employees, to make them aware of how the vaccine is being rolled out, issues around its safety, where the vaccine is being received from, and all such information that is required. And then, of course, the issue of undertaking risk assessment. I spoke briefly on my first point. For instance, if you have many employees, maybe you need to approach it differently compared to somebody who has only 5 employees, and how you engage with them. In Uganda, we are lucky that the government is providing the vaccine free of charge. So that makes it a lot easier for employers. And then, of course, planning for the different groups, those who have underlying conditions, those who are slightly older, those who may be disabled. And then lastly, the issue of privacy, because certain declarations might be made at this point. Maybe employees who have certain underlying health conditions might speak to you as the employer. They want to take the vaccine. It's your responsibility to keep that information private. Not speaking about, hey, this one also has diabetes. This one also has high blood pressure. privacy is critical. The data that employees will provide to you during this process, as an employer, you have the responsibility to protect it. You can't keep it in general files, which is accessible by any staff. For instance, you would have to have specific place, preferably under lock and key. You can't just put it on a computer which anybody can access and use. So if people's information should still be kept even during this time. And you don't have to provide explanation to anybody why somebody is receiving vaccine earlier. That still you need to keep their information private. In terms of the legal implications, first, at the moment, COVID vaccination is not mandatory. So there is no obligation at the moment to require employers to force their employees to get vaccinated. But the situation might change. Who knows how the situation will be in the future? Because the vaccine really is our best hope, that the more people are vaccinated, the quicker we are to eliminate COVID-19. You have seen other serious health conditions which have been eliminated in the past, basically through vaccine. Polio is a good example. It's almost disappeared. Smallpox and all this, they were a major problem to our societies, but with vaccine, many of them have gone away. Secondly, within the Occupational Safety and Health Act is the responsibility of the employer to keep the workplace safe. So it's your responsibility as an employer to ensure that SOPs are observed, not only by your employees, but also your customers, your other stakeholders that will visit your workplace from time to time. Thirdly, also your responsibility to ensure that employees are insured. Your workers need to be insured because actually within the Workmen's Compensation Act, you're required to insure your workers. So health insurance is a requirement, not only just because COVID is here with us, but also even before. It's our responsibility as employers to ensure that employees are insured. But the beauty with insurance, health insurance, it benefits you a lot more. It's actually cheaper for you when your employees are insured. You're shifting the responsibility to an insurance company. That's basically what you're doing with insurance. You pay maybe, let's say 700,000 per employee or 800 for a year, but you can access services which may reach even 10, 20 million. So it's a huge advantage for you and relieves you of a lot of cost as an employer, not just for COVID vaccine. The beauty also, even before the vaccine came, some insurance companies were already providing covers which are linked to COVID-19. So we have a lot of benefits there, though it's a legal requirement for us to ensure that there's health cover for our employees. Fourthly, the issue of educating employees. Again, I'm very grateful to the doctor because many people are saying all sorts of things. Some are because of religious reasons. Some are just saying DNA will be altered, all sorts of myths around it. But we have used so many vaccines. I don't think anybody, even those attending this meeting, have never been vaccinated. All of us have had vaccines and we are growing into very good adults, very healthy and safe. So vaccines are good and we need to continue with that process of education. I've already spoken about respect of privacy of your employees. Now, what can you do as an employer? First, the issue of safety and health audit. Is your workplace actually safe when it comes to COVID vaccine? Are people wearing masks? Are people sanitizing? Are you keeping the right social distance? Are we not forgetting about other health conditions within the workplace? Because we have also realized that when you have other health conditions, it's a lot more problematic when you get COVID. So safety and health in terms of other conditions as well. at least I would encourage all employers to provide the minimum cover. You may not be able to provide insurance for everything around health, but please, as the law demands of you, provide the minimum cover for health insurance for your employees. It's good for you. It makes business sense. It raises productivity. It's a motivation for your employees. It has immense benefit. Thirdly, a clear communication strategy for your employees, internal communication. And this internal communication goes alongside the SOPs. Put in place a health and safety committee within your workplace that meets from time to time, and they're able to see how safe your workplace is, but also support employees being vaccinated. There might be some mild side effects. Maybe somebody might not need to come back in the afternoon after getting the vaccine in the morning. They will go and rest a bit and return to work the following day. So it's important for you as an employer. Keep abreast with ongoing developments. New information is coming up all the time. And as we always say, like our president has already done, lead by example, get vaccinated yourself as an employer. That will encourage your employees to take it themselves. And then, of course, look at the various options which are available for vaccination at your workplace. In some cases, my last point is that you might consider a workplace vaccination program. Maybe you have so many employees and them leaving the workplace is a lot more difficult for you. You can discuss that with the ministry responsible for health. We have already seen Makerere, some other big institutions already having the opportunity to have vaccinations done at their workplaces. So that could be a possibility. Explore that if it's feasible also for your organization. Now, from FU, we have developed a lot of tools for you. That's the list of some of the tools that you might want to look at and see our guidance when it comes to workplace health, but also COVID in particular. Now, I just want to encourage all employers and employees that you need to stay safe. Even when you're vaccinated, you still need to protect yourself. You also have to stay focused and positive. COVID vaccination is an opportunity to enhance safety and health at the workplace, and we need to take advantage of that. And of course, from time to time, ask the right questions for your business, what you need to do, but also think after COVID, how will we continue to do business? So that's important. Thank you so much for listening to me. And as we say at the Federation, it's always together for employers. Thank you so much.
Wow. Thank you so much, Mr. Opio. Thank you very much. You've offered so much guidance for business leaders. You've offered so much guidance for employers. I'm sure if there's an employer here and they had a lot of gray areas, I think you have explained it really well. I'd just like to remind attendees of the points that Mr. Opio has raised. I mean, he's talked about communication. Communication is very, very key. You might not be doing so much for the employees, but the onus is on you, the employer, to communicate. Sensitization, sensitization is very key. I mean, don't let your employees get information from everywhere. Organize for them something like this. If you would like us to organize a webinar, Minet is available to do that. We'll get the right people to speak to your employees. We'll organize the webinar, we'll organize all the communication that you need. Just get write to us or call us, and we'll do that for you. He's also talked about insurance. He said the Employment Act talks about insurance, and we all know, as he has said, the Employment Act just offers the basic. But like he has said, you don't have to just do the basic. And budget should not be your problem. At Minet, we have such a robust employee assistance program that takes care of insurance. We're able to discuss with you and look at your budget, and see your budget and make a program, tailor program, specifically for you, specifically for your employees. He also talked about policy. You need to have the right policies in place. And then also he talked about a very pertinent issue that came up with COVID. He talked about mental health and safety and health audits. You know that last year we're sending out communication about having a workplace audit. I know that most organizations organizations are just getting back into the physical work, and some employees are not comfortable. You know, when I get to work, what do I do? Do I wear my mask, or is there enough distance between me and my colleague? Minet is able to bring in experts to see if your staff can work socially distanced, to see the risks that you're presented with, and then we'll give you a report and we'll be able to make recommendations. So please get back to us and tell us how we can support you. Thank you so much, Mr. Opio. So now we'll look at the questions. I see that Doctor has answered a number of questions that people shared in the Q&A, but there are some questions that a number of people had shared pre-webinar that we noted down. I'd like the doctor to answer 3 of those, and then I'll pick some questions for Mr. Opio later after doctor has answered this. Somebody's asking, I think this I can answer. Somebody's asking, how do I demystify the misconceptions and mistrust about the COVID vaccines? I mean, sensitization, and communication. We're able to come through and sensitize your staff. We're able to bring in experts to come and sensitize your staff. Also, as I'd mentioned at the beginning of the webinar, we have poll questions. We'd like you to answer the poll questions and share with us your feedback, because that's the best way we can help you. If you give us your feedback, please answer the poll questions. It will come straight onto your screen. Just answer. I see that the poll question has come through. Please answer and give us your feedback, and we'll be able to help you. So, Doctor, I'll read through 3 questions, and maybe you can note them and answer them at once. Somebody's asking, how long will the COVID vaccine protect you? How long will the COVID vaccine protect you? And then there's a second question. Somebody's asking, the communication plan for the vaccine continues to be overpowered by those against the vaccine. Is there a plan to enhance the communication plan? You're talking about the communication plan and saying it's being overpowered by those against the vaccine. Is there a plan to enhance that plan? And then the third question is, somebody saying, I'm very scared of taking this vaccine. Yesterday on Al Jazeera, countries were being called upon to identify the type of coronavirus they have before considering vaccinating people. What if the vaccine Uganda has received is not matching the coronavirus in Uganda? What happens? Over to you, Doctor.
So thank you so much for those questions. There are many others on the Q&A section. You can look at the ones I've answered there if you want to get more information. But I need to mention that we all need to remember that COVID has not been with us for very long. It's just a year. You know, it's from March last year to this year. So we've not had this disease for very long with us. The vaccines, on the other hand, have been around for about 6 months, 6 to 7 months. So since when the first people were vaccinated in the US, they've all been followed up. There's a huge of about 10,000 people who are being followed up in our study. And every month their blood samples are taken to check and see how much protection they are still having in the body. So we are confident, at least of all the vaccines that were started, they are now, we know that up to today, people are keeping very high levels of protection in their bodies. So the much we know is 7 months. Studies are going on. Those researchers are going to go on for about up to 10 years, just following them up. And then there's another one that was commissioned the other day. It's going to follow up people up to 30 years to see how long the protection lasts. So, and that is going to inform whether the companies give boosters or not, whether people need it every year or every 5 years or something like that. In terms of communication plan, this is a big concern, and not just for Uganda, but even for the whole world, you know, US, UK, Africa, the issues about hesitancy. And hesitancy is where people don't want to get the vaccine, yet the vaccine is available. How then do you bring all these people on board to get the vaccine? This is something that is giving the whole world a big headache. In 2019, the World Health Organization listed vaccine hesitancy as one of the biggest threats to global health. And what is happening now is that for Uganda, we have come up with a lot of initiatives for communication and sensitization. Just like it has been mentioned already by Doreen, that we are doing aggressive communication and aggressive sensitization. You can see Minet, what Minet is doing, bringing this session is part of that communication plan, making sure that people are provided with correct information, their questions are answered. We don't just want to tell people, why are you not vaccinating? Yet they have questions, and the questions have not been answered. So there's a lot of aggressive work going on to try and mobilize the communities from workplace, from church, from home, from TV, from radio. You usually see the president giving a lot of addresses. The goal is just to make sure that you give people the correct information. And we hope by and by, slowly by slowly, we'll be able to get everyone on board. In terms of the types, the variants of coronavirus, you know, this coronavirus falls in a type of virus called RNA viruses. The RNA type of viruses have a habit of mutating. They like changing their form and their nature. That is one thing they do a lot, which they are known for. So manufacturers of vaccines and countries keep monitoring every day. Everybody who goes for a COVID test, if you go for a COVID test today, you want to travel, part of your sample will be sent to a virus research institute. And what they do is that they look at it to see whether anybody has a variant that is different from what we've been having in the country. So far, Uganda has had only mainly the original type that came from Wuhan. We've had a few cases of the new variants coming in, but they've all been contained. So once they identify that you have one of the newer variants, like of the South Africa ones, they monitor you and observe you to make sure that you've cleared. Your contacts are tested and checked. The reason is because that we have to contain the spread of these particular variants. In our neighboring countries in Kenya, they have identified only 2 cases of the South African variants. Those were identified in December. Since then, they've not seen any others, but they've seen a lot of the UK variant. That's why Kenya has been having a very serious spike of coronavirus because of the UK variant, and they are very strong waves. So this is monitored, and then once that is done, like in Uganda, the vaccine that we have available, AstraZeneca, can cover all the current circulating variants in Uganda. In South Africa, they stopped the AstraZeneca and they went for Johnson & Johnson because it has a better cover for the variants that are circulating there. So basically, that is what is going on now.
Okay, thank you so much. Thank you so much, Doctor. I have received a question for, I think it goes to Mr. Opio. Somebody's asking, what do I do for my staff who don't want to take the vaccine? Emmanuel is asking what he should do for his staff who don't want to take the vaccine.
Thank you so much. I said earlier on in my presentation, Doreen, that at the moment, vaccination is not mandatory. Meaning the option left with the employer is just to provide the right information. People are not taking vaccine because somebody was saying it even on the chat that there's too much propaganda around it, too much negative information. So with the right communication and sensitization, an employer leading by example, people will eventually take it. All vaccines, most of them have been like this from time immemorial. People resist it. Even polio vaccines were resisted. People thought you would get crippled the moment you take it, but with information and as more people take it, it will go away. So education is critical. Thank you.
Okay, thank you so much, Douglas. I'd like to remind attendees that there's a poll questions, there's a couple of poll questions, and if you give us feedback, that's the only way we're able to know what you want, and that's the only way we're able to give you more of such content. Please, I'd encourage everybody to complete that a number of poll questions and give us your feedback. Doctor, there's a question that says, if this drug stroke vaccines evaluated by NDA, how come fake drugs are in the Ugandan market? If the drugs are evaluated by NDA, how come there are fake drugs in the Ugandan market? I'll also read this other one. In case the country achieves mass immunization, do we expect at one point that a relaxation on SOPs, or we have to continue with them throughout?
So thank you so much for your questions. The question of mass immunization, so the country is targeting to do 60%. When we do, if we are able to vaccinate about 60% of our population, we should be able to relax and ease our containment measures quite significantly. The CDC has now recommended in the US for people who are vaccinated to be able to ease up things like masks, things like, all those, in Uganda, we've not had as bad COVID as what people have elsewhere. There are countries where people have died. Brazil, for example, where you can hardly walk outside without a mask, you will definitely get COVID. Here, the cases are few and many people walk around without masks. But in those countries, you cannot try it. Otherwise, you'll die, So, so generally already our conditions are fairly relaxed, I would say. But things like curfew, things like what, those are likely to be more relaxed as we get more people vaccinated. In terms of fake drugs, that is an issue that is a big problem. It's not just drugs. There are a lot of fake things. You go to the market and you buy a plate, a cup, a dress, what. There are a lot of fake things and counterfeits. So that happens. But for vaccines, we do not yet have any because this is a very strictly regulated area. So those worries should not arise. And besides, even when we have drugs, getting fake vaccines is not easy because vaccines, one, are highly regulated. Two, they are given to normal people. So people don't just come and pick a vaccine. We had a problem once with hepatitis B a couple of years ago, but you saw it was immediately sorted because there's surveillance that is always going on to make sure that people are not getting a bad product.
Doctor, I'd like to also inform attendees that we received a number of questions. There were very many questions. So what we are going to do is to have our panelists answer them, and then we will email them to you, share with you a copy of all the questions that we submitted and the answers to those questions. For those who are asking if the presentations will be available, we'll see how to share them with you. Please leave your email address so that we can share those. Would like to give a chance for somebody in the audience who would like to answer, to pose a question either to Dr. or Mr. Opio. Please raise your hand and a technical person will enable you to speak. But in the meantime, okay, I see there's already one person who is ready to ask. Okay, Redemptor Atieno, please unmute yourself and ask the question. Redemptor Atieno. Please unmute yourself.
Thank you very much, Doreen. Thank you very much, Doreen, for giving me this chance. I actually have 3 questions, so I don't know whether I'm allowed to answer ask the three, or just one.
Ask them all at once, and then we will see how to do that. Just go ahead.
All right. So I'd also posted them in the chat and in the Q&A, sorry. So there have been so many myths. Sorry, my name is Redemptor. I'm actually tuning in from Kenya, but currently living in Malawi. So there have been very many myths, especially in Kenya, and propaganda about COVID, such as people believe that maybe when you're vaccinated, you'll grow a third eye or a third leg or something like that. There's also this thing about the depopulation agenda by the West, the Antichrist theory, you know, the 777 and all that. So I'm wondering, I'm currently a student of global health, and I'm wondering, my question goes to the doctor, how can you increase uptake of the vaccination with this kind of messaging in the community? Another thing, I'm just wondering, how come this, a natural virus, if COVID really is, would spread to the world in the same way, so fast? Because we have viruses like HIV that started in 1983, and it's taken decades for the virus to spread. So is this really a natural virus, really? And to my last question to Doka. So in Kenya, we have the AstraZeneca vaccine sent to Malawi, and there's been this issue of blood clots with AstraZeneca. And also there's been literature that the side effects would last for as long as 20 weeks after the vaccine. And also there's been issue of delayed menses or prolonged menses that could go as long as maybe 5 to 8 days. So the issue of these side effects, how long they should expected to take, the issue of blood clots. I know for example, in South Africa, they sent back Astra, and even I think 2 days ago, I saw in the South African media that they've also stopped Johnson & Johnson because of cases of blood clotting. So for the vaccines that we're having locally, I don't know about the cases, the epidemiology of the blood clots locally. How severe are they for us in African countries? And is it a cause for concern? Is it a cause for worry, really? Thank you.
Thank you so much, Redemptor, for your questions. I need to mention the first thing, you've raised an important issue that revolves around the whole issue of hesitancy. The question of people coming up with all sorts of theories, the population theory, the Antichrist, whether this is just a conspiracy to kill people. But the thing you need to realize is this. Look at Africa, for example. If one really wanted to kill Africa, we would not be having very few COVID cases in Africa like we have in the West. You've seen the West has been hit so hard than Africa. Africa actually has very few cases of COVID. It doesn't even hit, 10% of the world COVID cases in total, as it were. So Africa has generally been spared. And so those who always think that it's the blacks they want to kill, it's the blacks they're targeting, we have very few cases. I mean, 40,000 is the total number of cases of COVID in Uganda. If you pick Brazil or pick the US, those are the kind of cases they get in a day. You understand? And that is what Uganda has seen in over a year. So there is really no agenda of anyone targeting Uganda with COVID, no. At least that cannot be true if you look at the figures that we have. And even if it were possible by human power, then God has certainly stopped it. He has used an override to overcome that human power if it were there. Because Africa has seriously been spared of COVID. And the reason is because COVID is a disease that is affecting people who are older and people who have underlying conditions. You are looking at obesity, diabetes, overweight people, and those conditions of the elderly. If you look at the African population, pick Uganda, for example, more than a half of Ugandan population is less than 20 years of age. More than a half. Now, if you pick Kenya, for example, more than a half of the Kenyan population is less than 24 years of age. If you look at COVID cases in Kenya, the population under 20 years of age in Kenya comprises only 20% of the total COVID cases in Kenya. Only 20% are under 20 years of age. If you look at Uganda, for example, only about 12% of the total caseload of COVID in Uganda are under 20 years of age. So meaning more than a half of the population of Kenya and Uganda will hardly get COVID. That suggests that there is really no target. Look at the West and the developed countries, and you will find that majority of their cases, of their COVID cases, are above 50. And those are their people who have diabetes, people who have asthma, people who have heart conditions, and those are the people who are dying. So if COVID was an agenda, then the agenda is targeting the West. It's not targeting Africa. Whichever way one looks at, it's not targeting Africa. And if it's not targeting Africa, then we cannot say that it is they are looking for a way to eliminate Africans. If it's for the West, then it was to eliminate the people of the West. And the other thing is that, okay, those theories were advanced a lot for HIV, because HIV has really hit Africa. And they appeared, those conspiracy theorists appear to be working for them, but not for us. So then how can we increase vaccine uptake? What they are doing in the West, and which will soon reach Africa, is they are trying to see whether they can use vaccine certificate, to try and limit travel, maybe attendance of some particular amenities, hospital, school, work, and things like that. That won't reach here soon because we don't have a problem like that. We don't travel much, first of all, in Africa. And two, even in our work areas, we don't see as many numbers. As our brother from the Federation of Ugandan Employers stated, our work environments have been quite friendly and quite enabling for most of our people. And most employers have been quite friendly and quite enabling, because what we are trying to do is that we are trying to bring everyone on board, as opposed to being exclusionist. Our policies are those that encompass people, bring everyone on board, as opposed to saying we shall lock you out, we shall do. That's why even the vaccine is voluntary. If you want, if you accept, you are offered. So those are the approaches. Try and mobilize people, try and sensitize people, try and bring them on board, build confidence in the vaccine, and build hope in people that we can overcome this disease. Those are the strategies that the government and most employers are adopting. In terms of Kenya and AstraZeneca and blood clots, in Uganda, we've not seen much. Yesterday, I received a phone call from Mengo, and I think it's the first case we were hearing of suspected blood clots. But when we did Doppler, the patient doesn't have any clots in him. Though the blood picture appeared to suggest a kind of a clotting picture, and the patient has been treated, but was also found to have other underlying conditions that increase the possibility of clotting. So we are actively surveying. We are surveying all adverse events to see if we see anything to do with clots. In South Africa, they said they had seen an increased number of clots. But remember that South Africa has a very high white population. It has a very high population of the elderly. And so it tends more to having a picture like what is in the West than compared to the other parts of Africa. And I think that has contributed to what we've seen. And then too, they've had the variant, the South African variant that we now think is also tending more to clotting. Remember what I showed in my slides. If you have COVID, you are at 16.5 risk higher of getting clots than the risk of getting it from the vaccine. So South Africa has more cases of COVID, so they have more cases of people who can get clots than other parts of Africa. Delayed menses is something we've seen in women, not just with the vaccine, but even with the COVID itself. COVID causes delayed menses, it causes disorganized periods, it causes not just delayed, some even come early, some come late, and some even become painful where they were not. So we are seeing more with of those presentations with the COVID itself than just with the vaccine. With the vaccine, we've seen a bit of early menses and a bit of delayed menses, but eventually they stabilize. So I think that's what I would say in terms of answering your questions.
Thank you so much, Doctor, for such an in-depth response to some questions. Would like to have only one person. There's Amber. Amber has a question to ask, and then after Amber, we will see how to close this webinar. Amber, please go ahead.
Thank you, Madam Mowuli Doreen. I'm calling in from England, and I must say, with the laxity in the regulations, people have all rushed out to the pub to drink because they've been allowed to go to the pub. So I suspect the cases are going to go high even with the vaccination. And we are trying to take better photos so that we look good in case we die. It's uncertain what's going to happen in the coming weeks. That aside, I'm wondering, Dr. Malande, what are you doing as the medical professionals and as the insurance companies and, Minet gathering us here, but what are you doing at a bigger level as organizations to lobby the government to collaborate to get people to be vaccinated? Because the advantage of people in Uganda is the vaccine is there. And then there are so many mysteries and people are not taking it up even at company levels. What is being done at the collaborative level really to get people to get vaccinated as opposed to standing in theories? And then my other question is, are we suffering from vaccination on COVID or are we suffering from other things? For example, some of us have developed, are they called love handles? What are those things around the waist, which are not the belt? Are those results of the vaccination, or are people also suffering from sitting down, not moving, being stressed and restricted? It's really difficult to tell the impact of the vaccine. So my question is really what are you doing at a level to influence government? And is this the vaccine, or are we also suffering from immobility and other things? Thank you very much for organizing this.
So thank you so much for those very, very interesting questions. I should say that for Uganda and even Kenya, at least those two countries, because I'm a technical advisor for the ministries in those countries on COVID, the challenge we have seen is that we're actually facing problems of people not taking up the vaccine. It's not that the vaccine is not there, it's available. And I'm so happy for what Minet has organized now, because we are now actively building confidence for people to take up the vaccine. It's a real, Kenya yesterday, I looked at the data, and it has only been able to give vaccine to 15% of what it had targeted since when they rolled out the vaccine in March. In terms of healthcare workers, they're only doing about 25% of the initial target. The general community. So what in fact happened is that because Kenya went into another wave, they decided to combine the phases. So instead of just saying healthcare workers, they told other people to come who are elderly, teachers, security workers, hotel attendants, all these people who do work that exposes them, they were all told you can now come, because then there was a need to combat the problem of the third wave, which has been stronger than any of the first two. The first one was in July, the second one was in November, and now the one that is in March was really serious and killing a lot of people. And what we are doing in Uganda, we are also not meeting our targets yet. Just Malawi yesterday said they are going to destroy 16,000. Malawi, yes, I think it's Malawi, destroy 16,000 doses of vaccine which has expired. So you find that there are countries which are stuck with the expired doses because the expiry dates for these vaccines are very short. And the countries now have to destroy vaccines which they had not used. So we do have those problems. And what we are doing for us in terms of government is to try and ensure that we keep people, prominent people, to take up the vaccine. That's why you've seen presidents now coming up, cabinet members coming up, religious leaders. We are trying to get leaders who can drive the masses towards the vaccine, being encouraged to take up the vaccine. That we think is one way. Another thing is to mobilize more of the community, talk to people on radio talk shows, try and lobby everyone towards the vaccine. Your second question had to do with what we call COVID-associated diseases. There are other diseases that have come up because of COVID that are not caused by COVID. And you've mentioned good examples, sedentary-related diseases, people sitting a lot, staying at home, and therefore ending up with these problems. What we can do now under non-communicable diseases, what we can do now is to try and educate the masses on the possibility of the fact that as you avoid COVID, just sitting at home in the chair and not doing much exercises can cause you a lot of problems. We've seen mental health problems arising. We've seen problems in families. We've seen people developing diabetes, obesity. All those problems are arising because of lack of activity and exercise. So you are right. And organizations like Minet and other insurance companies, they need to be able to now alert people as to the possibility of other problems that may need to be addressed over and above just COVID. So thank you so much.
Thank you so much, Doctor. We've come to the end of the webinar. It's 1.5 hours, and the attendees are still in the meeting, and they seem like they want more, but would like to end it here. For those who shared questions and they were not answered in the webinar, like we said, we'll have the panelists answer them, and then we'll email them to you. I will ask both the doctor and Mr. Opio to give their parting shots, and then we can close. Doctor, I will ask you to give your parting shots, and then I'll hand over to Mr. Opio.
I want to say that I'm really grateful for this opportunity. This has been one of those, I've done so many talks during this COVID era for the last 1 year. It must be more than 100. But this has been really interactive. I'm impressed by the number of questions. There have been so many. The questions I received before the presentation, the questions I've received now, and very interesting ones. I will do my best to try and we have all questions compiled, answered, and then they'll be sent back to you for reference. The slides will be availed by Minet to all of you, the material for use. But thank you so much. I want to encourage you to get the vaccine. My advice to you is that the vaccine you get first is the right vaccine. There are people who've been telling me, so which one do we choose? Do we go for Pfizer? Do we go for Moderna? No, the best one is the one that lands at your door first. Get that one. Make sure that it is in your hand, then ask the questions after that. And please, let's go and spread the message. Let's get the vaccine. Thank you so much.
Okay. Thank you so much. Doctor, over to you, Mr. Douglas Opio.
Thank you so much, Doreen. Thank you, Doctor, and thank you, Minet. I think it has been a very useful session. Even for me, I learned a lot, actually. So I'm happy that I was able to attend. Of course, just for the employers, it's not my parting shot. I'm still with you. Anytime you can raise your question. Thank you so much. Have a nice evening.
Thank you so much to our panelists. Thank you, Mr. Opio. Thank you, Dr. Malande, and to all attendees. Thank you very much. I'd like to wish you a good evening. Bye, and thank you.